Yes. I'm gonna. Do you do that for Andrews? Will in the future be a robotic tray?
Good morning. Good morning, good morning, and welcome to the Saudi House this bright and early Tuesday morning. Thank you very much for coming today. We really have an exciting session today and some exciting voices. But not only do we have the voices here, but we also are streaming online, and we'll have an opportunity to take questions after a brief panel session this morning, both from the audience. Just a bit of admin on that. There will be some people walking around with an iPad. If you want to log a question, please do. It's going to come straight here to the front, and then we'll be able to register it and put the question to the panelists. We also have those online. Welcome to us here in Davos. An exciting topic today: collaboration in the intelligent age, transforming healthcare through virtual innovation. I was struck yesterday by His Excellency, the Minister of Economy and Planning for Saudi, who said, for far too long, investment in health has been a second priority. And together we need to find ways to work across the public, at government, at private sector to ensure that health is prioritized. Dr. Nouf Alamer, she had a call to action. Invest today to reduce the cost for tomorrow. And there is no greater need in that than on digital health. So we're going to kick off today with a very brief keynote from Dr. Shyam Bishen, who is an executive board member at the World Economic Forum. Dr. Shyam, please.
Sit here.
Yeah.
Thank you. Thank you, Jack. Good morning, everyone. It's a pleasure to be here. As Jack said, my name is Shyam Bishen, and I head up the Center for Health and Healthcare at the World Economic Forum. I'm also an executive committee member at the forum. So it's a real pleasure to be with you to talk about healthcare transformation this morning. A few members of my team are here, so and they will stay here with you until the end of the session. Unfortunately, I have to rush to another meeting after my remarks, but you will have a chance to interact with other members from the center throughout the session and toward the end of the session. So thank you again for joining the breakfast this morning. It's wonderful to see so many distinguished colleagues here. Again, thank you to the Ministry of Health from Saudi Arabia for organizing this session. Healthcare transformation is crucial in this day and age. You know, we are talking about so many challenges in the healthcare system as we look at what's happening to the societies, what's happening to the communities, with the aging population, with the NCDs growing fast. Even in Global South, as you know, non-communicable diseases, NCDs, have become bigger killers than communicable diseases. So the aging population, NCDs, growing cost of the healthcare system, there are so many pressures overall on the system. And the only way we can think about solving for some of these is through a transformational change. The incremental things that we have been doing so far are not going to work for us in the future. I think we need to come up with ideas, we need to come up with ways to completely transform the healthcare system. And this is where the World Economic Forum is now focusing its efforts. We are working closely with many countries, now obviously working with Saudi Arabia, but we are working globally with countries from both from developed world as well as from global south to look at this problem, see what are inherent challenges here, and how do we solve it. With our center, with the World Economic Forum, we are looking at 3 areas, on the overall healthcare side. First one is on the wellness side, on the health equity side. How do we make sure that there is equitable access to healthcare products and services around the world? How do we make sure that we not only look at the healthcare, not only look at the treatment and getting people well, but we also stop people from being sick, from getting sick. So prevention is another area that we are focused. So nutrition and wellness is key part of our work. So that's one vertical that we are working on, equity and wellness. The second one is exactly what we are talking about here, the healthcare transformation. And in that part, we have been having sessions since actually Sunday. We are looking at digital health. How do we use health data? How do we use digital technologies? Well, a lot of digital technologies need health data. So how do we make sure that we are using breakthrough technologies, virtual technologies, AI, machine learning, and all of that to solve for the healthcare challenges? When we think about healthcare challenges in broad sense, as I said earlier, health equity, access is a key challenge that we are trying to solve using digital technologies, using AI and machine learning. So access is one. The second one is outcome. And the third one is efficiency. As you know, I mentioned earlier, the healthcare cost is growing leaps and bounds. In the US, as you know, I live in New York, we are spending close to 20% of GDP on healthcare. In Europe also it's in double digit. And in all of these areas it's growing double digit, so 12 trillion now, 25 trillion by 2040, that's the projection. That's unsustainable. There is no way that we can continue to grow the healthcare costs and expenses at this rate. If you do, it will take over the economy. We won't have money to do anything else. So how do we control that cost and gain operational efficiencies, gain efficiencies in our drug development, in drug discovery, gain efficiencies in manufacturing and supply chain and delivery side? We see that digital health and AI can help there. It's not going to solve all our problems. We know that. Let's be honest about that. But it will help us quite a bit. So that's an area of focus for us. And I think many of you are working with us in that area on digital healthcare transformation initiative. And I think we would love to have more engagement and more involvement there from both. Idea here is to bring public and private sector. As you know, that's the platform for World Economic Forum. How do we bring public sector together with private sector, with academia, with civil society, with international organizations to solve for some of these challenges? So you will hear more and more from us on this, and you'll hear more and more of me talking about digital healthcare transformation as we move ahead. The third and the last pillar that we are focused on is more about emergency preparedness, which includes climate and health. Climate change, basically, as WHO says, it's a public health emergency. So we are looking at the impact of climate change on human health. How do we come up with good adaptation strategies, good preparedness to respond to climate change? Mitigation strategies are already underway. We have a long way to go there. We have a separate center that's just focused on Clean Air Alliance, focused on decarbonization. But in my center, we are focused more on looking at the impact on human health. What disease areas are growing because of the climate change. You meant from mental health to infectious disease, respiratory, all of these areas are getting impacted in a big way. How do we respond? How do we come up with good adaptation strategies and prepare for that? So those are some of the things that we are doing. Disease intelligence and AMR antimicrobial resistance, or those are also part of the overall emergency preparedness or pandemic preparedness. So I know I'm out of time here, but I wish you good luck for discussions this morning, and obviously, we will be working together with many of you. I look forward to the outcome of this discussion and working with all of you. Thank you.
Thank you, Dr. Shyam. Some important messages there. Access, outcomes, efficiency. How do we work together to define the solutions for the challenges of today and for tomorrow? I would next like to call to the stage a very dear friend and close colleague who has been driving forward the collaboration effort for international collaboration and cooperation for the Saudi Ministry of Health, Mr. Rakan bin Douish, the Assistant Deputy Minister for International Collaboration at the Saudi Ministry of Health.
Thank you very much, Zach, and good morning, everyone, and thank you for joining us in this early hour. It is good to be here and to be part of the Saudi House. And in the name of the Saudi House and the Saudi delegation, I welcome you to the Saudi House this morning. It is a good place. If you look around, there are many initiatives that are relevant to Vision 2030 and also to the vibrant society of Saudi Arabia. We have Dir'iyah initiative, Al-Ula, Ministry of Health as well, Ministry of Investment. So there is a group of representation which I welcome you all after the session to walk around and meet our colleagues. Second of all, I would also thank Zach for organizing this event. I think it is especially important to talk about healthcare in this time. After the pandemic, we've learned a lot, and now we need to work more together into transforming health sector, addressing challenges and issues, pandemic preparedness and response, antimicrobial resistance, non-communicable diseases, many that we need to address. And of course, digital transformation is an integral part and something that we need to focus on. So therefore, I think the collaboration for intelligent age resonates well with the Vision 2030 and as well resonate very well with the transformation of health sector in Saudi Arabia, which is the largest health transformation. So we're harnessing technologies to transform systems and improve lives wherever they are. And you will hear a lot today about virtual hospital and how this is increasing accessibility. We're leading when it comes to AI-driven healthcare innovation through the largest healthcare platform, the virtual hospital, and as well as initiatives that are relevant to data such as Nafis and initiatives that are relevant to biotechnology and the strategic 2040 biotechnology initiative in Saudi Arabia. So I welcome you all even to stop by our booth after the session and learn more. We will be talking a lot today, so I don't want to take much time. And thank you very much, and thank you, Zach.
Thank you, Mr. Rakan. May I please call to the stage Dr. Shay Partova, the Chief Innovation and Strategy Officer at Philips, and Dr. Abdulaziz Al-Hamoud, the CEO Advisor to the Seha Virtual Hospital. So we've heard already the challenge, but I want to take a step back for you for first question, Mr. Rakan. From the international perspective, how do governments work together? And you've been on the road, you've been having multiple conversations, Saudi's a member of the G20, the conversations there at multiple international forums. What are those conversations, and how do governments really work together to address some of these major issues and enable digital health to provide better access and also increase efficiency?
Well, thank you, and thank you for asking this question, first question in the morning. So, no, what we have been doing, working with member states and countries and different platforms, whether these are the G20 or the World Economic Forum or any other multilateral platform. Saudi Arabia is very active, even in the region when it comes to the GCC or Arab League or Islamic cooperation. We're active in multilateral development banks and financiers. So all these platforms need to be oriented around priorities, and these priorities need to be agreed on with member state countries. So I think leadership is important. If we look at areas of importance these days, for example, antimicrobial resistance, we were speaking about it this morning. I think what we have been doing last year, 2024, and we need to continue work on, is to get momentum around challenges. We've hosted 60 plus ministers in Saudi Arabia and agreed on a communique and commitments around antimicrobial resistance. Now, what is next? How we can implement? So I think these international platforms serve as platform to agree on way forward. Now, when it comes to digital health, I think what we are proposing so far is to work with the World Economic Forum, with the World Health Organization, into a coalition between private sector and public sector. It is an area that needs more policies, an area that needs to agree on a certain set of procedures to implement virtual hospital, to implement digital health. So we have to have, and we have to find a platform, the right platform to discuss policies and hopefully implement it as we go down the road.
Excellent. Well, let me then call in Dr. Shea. From the private sector perspective, you're hearing about government collaboration and cooperation, addressing big and real-world challenges. You're in some of those same rooms and having conversations with ministers and other government delegations. What is it that the private sector needs from government, and how can that collaboration really move forward and drive forward?
Terrific, thanks, Zach. Well, Philips has been actually supporting the Vision 2030 for some time already. In fact, Philips was one of the in the first 40 multinational companies that actually subscribed and put headquarters as per the Vision 2030 plan in the kingdom. And when we look at the challenge, as you pointed out, actually this is a global problem where the chronic disease increase and the shortage of physicians really means that virtual care and the virtual hospital that you're going to talk about becomes a critical part of fitting the gap between the need for care globally, and particularly in the region, but also the supply. And so the work that we've done in Saudi, a great example is the work we did with the Medina Health Cluster, where the virtual tele-ICU initiative that we put in, where physicians in one area can, of course, remotely connect and deliver care to individuals in other areas. This helps deliver on the vision for 2030, as well as really deliver better care for more people. And this is really a focus of Philips. Now, when you ask exactly what do we need, I mean, the collaboration and the discussions we're having here are exactly what we need. But also at the end of the day, and we were talking about this before the panel, which is there are economic considerations to virtual care. It's, we are the system of care, notwithstanding COVID, is really set for in-person care, not both in care delivery, but also in the economics of it. And so looking to see how we can, as a collaboration, look at models that not only deliver better care, not only improve access to care, but actually make it sustainable, both for the planet, but also economically, are some key things that I know we've been talking about that are really important. So it's great to talk about technology, and we definitely can deliver on that, but to make it sustainable, you have to have an economic engine behind it that actually enables it to continue to go. And I'd love to hear when you get to your discussion of virtual hospital, how that is an area that you're focusing on and how you make those ends meet.
Can I just come back to you on one follow-up on that? I read a recent article, I think, that you had put out about generative AI and how today only 1/3 of healthcare leaders are investing in that technology. How does Philips work with, and others within the private sector work with government to be able to solve that gap?
The generative AI question, or AI question, is really interesting. We surveyed about 3,000 healthcare providers across the world, and about 90% said, this is my hope. This is going to solve my problem. And then we said, are you implementing it? Not yet. And Are you skeptical about it? The skepticism was like 60%. So on the one hand, they're incredibly hopeful, but they've all been burned by the electronic medical record wave where it really caused burnout. And so you have this incredible hope and yet a skepticism. So the way in which I think we as an industry in the sort of the private sector have to be able to deliver is to make sure we work back from the desired impact, as opposed to this is really cool. So if the desired impact, for example, in tele-ICU, the desired impact is less deaths in the ICU, less complications, less cardiac arrests, shorter length of stay. Okay, well, actually at Philips, we've published that the EICU has 35% less adverse events, 40% less deaths in the ICU, 80% less cardiac events. So if you work back from impact, physicians are scientists. Show them the impact, they'll adopt. Show them the outcome for the patient, they'll adopt. Tell them it's a cool thing that you now have to do more clicks. You may as well not try. So I think impact is the thing.
Yeah. And we're going to come on to workforce in a moment. Let me turn to Dr. Abdulaziz, who was the chief medical officer and started with only a couple of people at the Seha Virtual Hospital, now the biggest virtual hospital, I believe, in the world. Dr. Abdulaziz, first, just tell us a little bit more about the virtual hospital and how the virtual hospital can address some of the challenges we've heard already today.
Absolutely, thank you. And I'd like to thank you, Zach, for the work that you're doing and the effort that you spent planning for that. Mr. Rakan, Shyam, and Shez, all the comments that you've highlighted is what we say in all our discussions. How do we make dreams come true? A lot of impact and outcomes of digital health and virtual innovations has been done and written for ages. But what we did, I think, when we started the virtual hospital, we had one thing in mind, that we want to do more with what we have. We want to take the most out of every box that we spend. And we want to use technology. We want to use technology to promote healthcare. And the beauty of working there, I remember when we started late 2020, was everybody was hungry for evidence, for impact. Healthcare was taking a lot of people's thought and government decisions and financial constraints. It was easy for us to work hard, study hard, and bring evidence to the right people at the right time in the right format. When, for example, we spoke about the cost, how today, if we continue to do healthcare the way we do, we're just going to go bankruptcy, everybody. And we see some countries that are underfunding healthcare because they have different priorities. We were lucky to work under a clear vision. Vision 2030 was very laser focused on outcome. We were able to quickly link digital health outcomes to what we want to do. We want to increase access. Today we're proud to say that the government in Saudi and the Ministry of Health and healthcare overall has an outstanding access to the community. Well above 95% of essential healthcare is accessed by in the country. Not only that, we were very innovative in workforce. We knew the gap, and we didn't want to, accept subpar quality of care. And how do you run tons of ICUs simultaneously with the same quality? Mm-hmm. Can we do that? Yes. Is there an evidence? Indeed. Did people prove impact? So when we started the tele-ICU, we started to prove the concept that it works and it's the right decision at the right time for the right people. Today, we just got Guinness Award for the largest connected healthcare system globally. In ICU, in telestroke, in cardiology, we basically democratize access to the right expert at the right time with a very efficient way. Final comment, in ICU, we made physicians comfortably manage at least double the load with way lower stress level and challenges.
If I could just come back then to Dr. Shea, what are some of those breakthrough technologies a little bit more on what can be replicated and put within the virtual hospital arena?
Well, the work being done there is already terrific. In fact, for example, and I know it's not exactly in the virtual hospital, but the Taji Cardiology Network in Saudi Arabia is the largest virtual cardiology network in the world. I mean, it's, I think it was, last time I counted, it was 10 sites going up to 30, working with the Ministry of Health hospitals, where patients can get high-level standard cardiology care no matter where they go in this network, the same workflow, the same quality, consistency, where the mechanisms of seeing the patient, managing, monitoring, resulting, and then delivering results and next action are all standardized through a virtual cardiology network. I mean, these are incredible achievements in the region, which, as you said, it's delivering better care for more people, cardiology being an example. I think in terms of the technologies that will enable this, so I'll give you really one of my favorite examples of technology that can enable delivering better care for more people is the work we're doing with the Gates Foundation. And if women who are pregnant need to have one ultrasound at least. World Health Organization says in the first trimester, first 24 weeks, a woman should have at least one ultrasound to check to see if the baby is doing okay. Now, finding a trained sonographer that can do a first trimester sonogram is not easy, and training is like a few years. And so this is an example where we brought AI with the Gates Foundation into our handheld ultrasound called Lumify, where literally with 2 hours of training, you do 6 sweeps, 1, 2, 3 up, 1, 2, 3 across. And the AI algorithm, it's not that it generates a picture, it does all the measurements needed to determine if the baby is having a healthy pregnancy or not. So this is an example where improving access to care by embedding AI into technology that then now can be done anywhere, where you cannot find a sonographer who's got 3 years training, who knows how to do the 5 measurements of head circumference, crown rump length, where's the placenta, what's the baby's heartbeat. These are the 6 scans, AI does it and gives the numbers. Done. That's how technology can improve access to care.
Fantastic. And I think the key and the plea here is we need governments to prioritize. And let me turn to Rakan. Obviously, Saudi Arabia has prioritized, but maybe talk a little bit more about how Saudi Arabia has prioritized not only healthcare, but digital, and then what Saudi is doing related to that in terms of building global coalitions for digital healthcare with the virtual hospital.
Well, I think it is first of all an ecosystem. If you look at what is the ecosystem of digital in general in Saudi Arabia, you will see all the main actors, all the required institutions. There is very good harmony and work programs together. And then it comes, even including private sector. If you look at STC, for example, an enabler for virtual hospital and health transformation. The private sector telecommunication is an enabler for that. So I think, first of all, the ecosystem is there and the required policies are available. Second of all, what we wanted to achieve is increase efficiency and reduce cost. If you can achieve this through the digital platform that you are proposing, I think you will be achieving, and this is what Dr. Abdulaziz alluded to. So I think these are 2 examples that we need to take internationally now and to use it as a best practice, perhaps, and also to develop. It might be good, however, there will be, of course, chances to develop and to work with the international community in order to revamp and review the processes and how we can make it something that can talk with international systems. I think this is what we're trying to do with international collaboration. There has been initiatives so far. At the WHO and the G20, we initiated Global Health Digital Initiative. Now we're working closely with the World Economic Forum. We're working with the other digital institution, international organizations to make sure it is fit for purpose. Now again, we need to address also funding. Now how we can incentivize development agencies and financing, development financing agencies to ensure that there is required financing for this and implementation in countries of need. So there is still a lot of international work that we need to work on and to focus in order to deliver a meaningful platform that can be accessible and useful.
Can I give one example of
Yeah.
terrific work? Actually, as a real example of terrific work that's collaborative, and thanks to, of course, the Ministry of Health. We did a collaboration with the Saudi Data and AI Authority because the goal of the authority was to build a locally built algorithm for breast cancer detection and lung cancer detection. And so Philips Research partnered with the SDIO, Saudi Data and AI Authority, to actually use data locally from the kingdom to build the algorithm, which is then put back into the radiology reading station. So as the radiologists are interpreting the studies, whether the mammogram or the chest CTs, the algorithm actually applies detecting, looking for cancer of the breast or cancer of the lung. So this is an example of the collaboration that occurred, actually delivered impact and results being put in practice for Saudi citizens today. It's actually being used.
So I think this also touches on a broader point about health literacy.
Yeah.
And I want to come to Dr. Abdulaziz because in my country, United States, we have many who don't trust what comes from medical doctors. They don't understand how to read the reports. Some don't have access even to the technology. And I think that's representative to many countries and small communities, rural towns. How can the virtual hospital bridge that gap in terms of health literacy?
Yeah, 100%. I'm going to take a dive into that. But two comments. For Taji as an example, so Taji is also within the virtual hospital. Taji is coronaries in Arabic. It's one of the most fascinating use of technologies that I've ever seen, where cardiologists within all cardiac centers in Saudi are basically part of the same ecosystem. If someone is providing care in the southern region, northern region, east, west, or in Riyadh and central region, they basically have the right infrastructure that is very mature, as Mr. Rakan just highlighted, from a connectivity, from cutting-edge technology, from the ability to put artificial intelligence algorithms within the ecosystem. You don't need to take an extra mile. You don't need to be unique or very early adopter person to actually use artificial intelligence within the Taji system. We were able to take the practice to the next level with the right infrastructure, the right government mindset, and the right human-centric approach. And this is kind of how we're going to dive into the personalized or the health literacy elements. And if you look at Taji, when we started it, it's not new. But what we did with it is the new thing.
Exactly.
Is the cutting edge. We were able to easily utilize Taji in cardiology, for an example, to first show how to collaborate globally. Almost 10 countries now are engaging with our multidisciplinary cardiac committee. And this is just the start. We were able to use advanced technology like not particularly 3D, but interactive mixed reality approach to help physicians who are doing a procedure remotely to actually get guidance. I've seen that, as a former chief medical officer, I would sit in the room and see how the cardiologist and the proceduralist and the team work together to provide the best quality and outcome with just the right cost, nothing more. And when we did that, we basically cracked the code of providing high-level care without going bankruptcy, and equally everywhere. So today, the innovation around the processes and utilizing technology and workforce is unique. we could hire 3 more staff within the virtual hospital, for example, and serve for way more than that number. So when we started the literacy, first, if for people who, and some people has already visited the virtual hospital, you will see how from day one it was a people-centric approach, where everybody is doing just what they're, prepared to do, and are able to provide the right training and guidance to their staff. What's unique in Saudi when it comes to literacy is almost everybody has access to technology, to internet, has access to smartphones, are using Sahati or all these apps during COVID, during all these. So everybody is already onboarded. And a lot of our patients are, we call them an active digital citizen or patient or a partner with the healthcare. So the level of literacy that we wanted to tackle is basically technology for health, not particularly technology. So everybody's using all these apps. It was a beautiful kind of approach to see. And an angle that we wanted to tap into briefly was how do we improve capacity building across all these sectors. Physicians, they need more capacity building in technology. Technology experts and innovators, they need more capacity building in healthcare of the future. Decision makers, they need to know what is the actual impact. Finance people, they need to also help us build a financial plan and apply it. So, and Mr. Rakan just highlighted, working in this project within the Ministry of Health was, despite some challenges, was basically like riding a bicycle. You learn how to do it, and then you have everything else to exceed. And that's why we are the largest virtual hospital in the world. Yeah.
It does touch on that critical point about workforce burden and enabling and using AI and technology to be able to alleviate the burden on the workforce. If I come back to Dr. Shea, what is next in terms of breakthroughs, in terms of the next technology that's coming out that you're seeing, the conversations you're having? Don't disclose any secrets, but you can if you'd like, about kind of what's...
off the record streaming, right?
Yes.
No, but actually, to maybe I'll connect to the question you asked, because this is where I think the real excitement. You know, the potential of generative AI is to provide personalization at scale. The health literacy question, here's a real life example. So we have also, in addition to the things we talked about, Philips also has an electronic medical record. It's mostly in Latin America. But in Latin America, we actually have technology that patients talk to their chart. So if you use ChatGPT and you're talking to ChatGPT, imagine if at the other end of that is your medical chart and knows everything about you, and it's actually in terms of closing the health literacy gap. So in our TASI electronic medical record, patients don't just have a portal. In the US, you know, a portal is, and nobody likes it because it's got all these, and you have numbers, you don't know what it means. You have electrolyte values, CBC values, what does that really mean? But you can actually talk to the chart. I think what we're going to see on the side, I want to say on the side of the patient, the opportunity for personalization at scale, that's what AI unlocks. Because patients currently, I look as a physician, I'm the personalization for my parents. Whenever they get a report, they text me the report. Can you translate this for me?
Yeah.
And I'm their ChatGPT on my text. This is what it means. This is what they're saying. That's not scalable. I can't take everyone's text. But with AI, personalization at scale is going to close the health literacy gap. Right. And what it's going to allow is for patients to take greater responsibility for self-care. I'm really excited about that. I'm really excited. There's a lot of stuff on the physician side I'm excited about, on the OR and the angio suite, on the MRI. I could talk all day about that. But as all of us being humans and all of us at some point needing care, this ability to personalize at scale is something that's going to change the planet.
Yeah, it's a very interesting point. So my, just a personal point. So my daughter had autoimmune neutropenia. And when we were going through this process of engaging with doctors, it's really difficult to understand. I became half a doctor. I felt I don't have a degree, but I felt like I'm half a doctor trying to read the report and CBC counts, and I'd never heard of a CBC count before having to deal with that. So I think, to your point, it is absolutely critical. Coming back then to Rakan, how do we get governments to recognize that this needs to be a priority in terms of funding and in terms of, prioritization first and then funding more broadly? How do we drive this forward? And Saudi Arabia is really leading the charge. I mean, Saudi Arabia is driving forward on health and all policy as well. But how do we get governments to engage and drive this forward?
Well, I think they need to know that it will touch their pockets if there is no action. It is important to show the economic impact of the challenge itself. And I think we need to make sure that they are engaged in the process. One of the issues that we always face is that health is segregated somehow from many line ministries and many initiatives. So therefore, we need to make sure that we show the economic impact. We show how this funding gap is going to affect and impact other initiatives. And this is what we're doing closer in Saudi Arabia. Yesterday, we had the session on health and all policies, which is a ministerial initiative where more than 11 ministers sit and discuss health and health issues. So we've taken a toll on this. Internationally, we have seen platforms that are relevant. The G20 had health and finance ministers gathering to discuss issues. If you look more broader, even in the pandemic preparedness and response at the WHO, where we discuss financing in particular and issues of that nature. So therefore, we need to make sure that digital, to show the impact, the economic impact of digital health, how it will increase efficiency and reduce cost. And I think they will be excited, finance ministers, to focus on this and allocate the required financing to reduce cost. Eventually, health is not an easy budget. It is a significant budget on countries. So therefore, any mean that would show how it will be reduced, that will be something that we need to focus on.
Right. We do have opportunity for questions, and there's a couple of gentlemen with iPads and a lady here. Just to enter your question in, and it'll come straight over here. Just coming back then to Dr. Shea, you talked again, and you've talked about this already, but just again to talk about the bridging the staffing gap, bridging the insights gap. You've talked about this. What is next in terms of the technology that we can look to on that?
Maybe some of the most exciting things I think that we see, because it bridges hospital and home. Maybe I'll reference, because this is one in which we just recently published as well. I think to your point on cost reduction and improving care quality, maybe one of the great examples I can give is actually monitoring heart rhythm at home and or prior to discharge. So patients everywhere in the world, and particularly with increasing aging population and increasing cardiac issues, being able to monitor the heart rhythm to predict potential arrhythmias is one area which we're seeing tremendous opportunities, and Philips is really leaning into. So for example, we just published 2 algorithms where we'll monitor the heart for 24 hours and then predict if in the next 2 weeks a patient will have an arrhythmia, a life-threatening arrhythmia. If you can imagine prior to discharging a patient from the hospital, if you had this tool where you look at the last 24 hours of the rhythm strip, or you don't look at it, the algorithm looks at it and says, this person is likely okay to go home. This person probably should stay a little longer. In terms of cost of care reduction, the person who's discharged has an untoward event, has then ambulance readmitted. That's a cost of care that you're avoiding by an algorithm that says there's a high probability for an arrhythmia that's life-threatening in the next 2 weeks. And so what we're going to see is that the insertion of AI into these branch points of decision trees in medicine, where the decision tree says the algorithm predicts with a probability that this decision path has an untoward effect, and you should consider this, what people call next best action. In that case, the next best action is don't discharge.
Yeah.
And that, if Netflix knows the next best action of all of us, right? The next movie it recommends is the next best action. And so applying those technologies so that you get higher quality care at reduced cost, that's the heart of where AI can really make a difference globally. I mean, that's really where we're going to see more and more of those kinds of insertions, atomic insertions of algorithms for next best action. And paradigms of care will change. You won't be running it based on a research from 20 years ago. You'll be running it based on data that's just coming from you, streaming from you in the last 18 hours or 18 months.
Right. And we need to build awareness about about the technology.
I'm here.
And you're here. And we need to deploy it through the virtual hospital. I've got a question here, which I think is a great one. It says, digital health presents an incredible opportunity for international collaboration on health, but we are seeing global fragmentation. That is true. How to keep collaborative? Let me come to you first.
Well, I think this is exactly the issue, and this is what we have been seeing, the fragmentation in the system. For example, now, of course, governments meet and discuss issues. However, there is a gap with the private sector. There is a gap with other financiers. You mentioned Bill and Melinda Gates and others. So we're working with these entities now into more creating a coherence and creating more structured dialogues around issues. It was testimonial last year, 2024 in Saudi Arabia on the AMR. We've brought everyone together. We're going to do something again also with these institutions and also in closing this fragmentation. We need to agree on what are the priorities that we need to finance. As countries, and again, as countries, we need to agree on what are the priorities, how we're going to address them. We need to work with technical institutions like the WHO and helping us implement these and agree on the outcome. So I think it is more of dialogue, more of cooperation that is needed at the moment.
So that collaboration and that cooperation, but it also addressed, as we've already said several times, the emerging trend of funding and cost. So a question from the audience, how can we define a fair price for AI tools in health? In other words, how do we apply health tech assessment to AI? Maybe Dr. Shea first.
Actually, this might be a better question for you.
Sure. Yeah.
I can answer it too, but I'd love to see your thoughts.
Definitely. So the way we look at it is, first, briefly on the global collaboration, you have to make the case.
Right.
And we've successfully made cases in different venues, and we're able to come up with a good collaborative approach. Good example is the Hajj health card. Quickly, with the WHO, with the G20, 3 countries in no time had their Hajj patients with complete interoperability in data and with 100% utilization in emergency care. So make the case, fragmentation will go away. When it comes to artificial intelligence and funding and fun part, in every panel I attend, a lot of people will say, imagine, and this is a reality at the virtual hospital. So the cardiac monitoring post-discharge is active already, and we've seen the value of that. And this happens in every panel. Anyways, for your point, the pricing, I think it's going to be a digital therapy. When you pay for an image, you should subsidize that for artificial intelligence. We don't want you to pay double price for it, right? This is the thought process that I wanted. And it was built with patient information, experts' opinion, and technology. So the funding should look at those 3 partners.
Fantastic. We're just wrapping up then, and I want to close by asking each of you, and I'll give you a second to think about, what is one message that you would want to deliver to this group here, but also to all those that are listening around the world? What's the call to action from you? I'll start with Dr. Shea, then Dr. Abdulaziz, and I'll conclude with Rakan.
I think coming back to that comment we made earlier around everyone sees technology as a hope, but there's a lot of anxiety and skepticism around it. I think my advice is to lean into it. Lean into it, start small, but keep going. I think there's really the benefits are there. There's obviously organizations that have actually realizing the benefits. Don't stand at the pool's edge. Dive right in head first.
Very good.
Yeah. I think it's the way to survive, the way to take the best, to stay healthy we're able to extend our life expectancy, but to stay healthy, collaborate, be forward, think big, move fast,
like
and
it.
it's okay. Yeah.
Very good. Rakan?
Well, I would say real progress, tangible outcomes. Global health has been reimagined in Saudi Arabia, and we're happy to promote and work together into achieving more results.
Thank you, and thank you to all of you who have come today, and I hope we can continue this conversation because it is one that we do need to continue. We need to drive forward. We need to ensure this is a priority, sitting at the government level, at private sector. We need to drive greater collaboration between the two. We need to bring the global virtual hospital, the SEA virtual hospital, to more countries as well, and increase collaboration and cooperation. We need to lean in, we need to think big, and we need to drive collaboration more broadly. Thank you very much, and thank you for your session today.
Thanks, Zach.
Thank you. Thank you.
Thank you. Outstanding. Thank you so much.